Hi YouTube, my name is Adrienne. I am a nursing student at UTMB here in Galveston, and I completed my first semester of nursing school a couple of weeks ago. So I'm here to just talk about first semester, how it went, the classes I took, labs, clinicals, tips, and things like that for passing your first semester. So please stay tuned.
Keep it 100.
So let me start by saying a little bit about my program. It is a traditional program for our BSN, but we are slightly accelerated. It's a 16-month program, so it goes by very fast and it's very rigorous. We take 4 classes each semester, and our breaks are usually much shorter, only about 2 weeks, and we do have classes during the summer, so we don't get a full 3-month summer break. So during our first semester, we took 4 classes, and I will go through each one of them kind of slowly and in description of kind of the things that we learned and what to expect. So the first class we took was Intro to Nursing. This is what everybody thought is a fly-by course. It's, mostly random facts. It's how nursing started and learning the pioneers of nursing and kind of rules and regulations regarding nursing. The class isn't a hard class, but after the first exam, some of the questions will kind of trip you up. So it is a class that you have to study for, and it's more fact-based. But of course, they do have the NCLEX style questions where you have to think a little bit more out of the box as opposed to your normal questioning. During the first semester, after the first 3 weeks, we typically had an exam once or twice a week between our 4 classes. And so when it came time to exam time for intro, it was always a last minute kind of let me hurry up and study for this. Not necessarily putting an all-nighter, but kind of studying 2 to 3 days before some of the other classes. You kind of have to start weeks in advance. Our next class was health assessment, which has a lab with it, and basically it's where you learn the full head to toe assessment. You learn how to examine the skin and the eyes, the nose, the body, the abdomen, and you learn it system by system, as well as in the class and in the lab. The book follows it, and you do have to get like a study guide that you have to fill out for lab, which is supposed to help you for the test. And you definitely want the physical copy of that physical examination book. There are pink sections that have abnormal, just like normal things that can happen, sicknesses and abnormalities that you will be tested on and you're expected to know, as well as learning how to do your actual assessment, your pain assessment, your AIDED, which of course is how we introduce ourselves and everything. And by the end of the semester, you're expected to know the full head to toe assessment, but in parts. We had different stations with different professors that assessed our head to toe. So the cardiac was one, the lungs were one. They did put a few of them together, like of course head, nose, and mouth. Typically kind of went together, a few systems that are very close together that put together, but it's a lot to know. We also had to know all the cranial nerves and exactly what they do. So it can definitely kind of trip you up if you're not prepared for it. The exams in that class, like I said, you have to read the book in that class, and especially the abnormal things that can happen with each body system, because she does test you on them. You have to know how the body is supposed to be normally, and then what's the difference with them as far as if something's wrong. And that's kind of for all classes, especially in nursing. And the class is basically important because it is the basis of everything as a nurse, as we do. Everything we do is an assessment. We might not do a full assessment every day, especially depending on what department that you work in, but it's always some type of assessment, even if it's just looking at the legs for edema, if it's looking at the skin for pressure ulcers, which is a lot what we learn. And the professors are usually pretty good. So this class is usually about 2 hours long, and then we have lab once a week, which lasts about 3 hours for lab. And during this time, it's kind of the practice. They kind of show you videos on what to expect, how to assess the body part that you're assessing, and then we practice. You kind of split up into groups and you practice. And then as you learn each body system, I would suggest always going back from the beginning and working your way down to where you currently are, just because you have to know that full head to toe assessment to pass this class. And then especially the professors for this one, your exams do get very tricky. They're starting to use the new NCLEX style questioning in health assessment. So it's basically, it's nothing that you haven't done before. It's just a different format. All the questionings, like I said, is more NCLEX style. It's more nursing style. They're slowly getting you ready to take the NCLEX. That's basically the job of nursing school, is for you to pass the NCLEX. And of course, UTMB has had, you know, they haven't been below 98% pass rate for first time NCLEX users in, I don't know, 4 or 5 years. So they know what they're doing, and if you follow what they're teaching, you should do okay. So the third class that we took was pathophysiology, which is basically how the body reacts to being sick and the different disease processes, which is the framework of nursing and the other classes. This is probably the most difficult class, as it is a lot of body systems. It is a lot of different diseases. It's a lot of knowing lab values. It's a lot of knowing signs and symptoms of literally everything. This class is very difficult, and studying for it is difficult, and how to study. A lot of the people before our semesters said just look at the PowerPoints. No. With this, you need to actually go in and read the book. And when I mean read the book, I don't mean read the entire book. The book itself is, I don't know, 3,000 pages. There's no way you can read them all, and they don't go over every single disease. If they did, this class would be 5 hours per day, 10 hours per day. It's a lot of diseases, but the ones that they go over are the most common, as well as the signs and symptoms. And for our final class, it is Essential Cares for Adult, which is basically our med-surg class. It's our adult class where we have lab and we also have clinical. As a lab portion, we learned how to do a intramuscular injection as well as a sub-Q injection. We also learned how to place a Foley sterilely, as well as we were shown how to do an NGT. And just like in health assessment, all these skills are validated. So you have to know how to do them. You have to know how the medications, as far as insulin and morphine reactions, you have to know how to speak to a patient. You have to know just what to ask, and they teach you everything. They don't leave you in the dark. You do have a couple of sessions where you're able to practice and learn the wordings and what to say and how insulin and morphine reacts in the body, so that you're able to make sure that you're administering medication safely. During adult class, we also had a few simulations, which were fun, where we got to go into a room with mannequins, and of course we had professors and assistants kind of guide us through, and it was the first time we kind of experienced that, so it was kind of like we're taking care of a patient. We got to briefly see a few vital signs and what's wrong with the patient, their main complaint, and we're basically pretending to be the nurse or someone that's there just to observe, just to see what we did right, what we did wrong. And honestly, it's not bad. You don't get reprimanded for it. It's not graded. It's basically to see how we interact, what we could do better, what we could improve on, what we did well in. And all of these usually actually kind of start after our clinicals. We started semester at the end of August. Our first classes were on the 29th, and then we started on October 1st. So you get about a month period before you actually start your clinicals. So by that time, once we did the simulations, we're kind of okay with speaking as we were speaking to patients and things like that. So it was a little bit less stressful. We just didn't know what to expect because it was a full sims. As well as we did a telehealth day where we actually had a real patient that was acting, and basically we had to assess what was wrong with them. We had to do a focus assessment, and that was actually fun. It kind of showed us a little bit about telehealth and speaking to a patient over a camera. It was very interesting. And it's a learning environment. That's what nursing school is. It's all about learning, and they won't leave you out to dust to dry up. Literally, they're there helping you. All the teachers and professors are down to earth, and they understand because they all went through it. Every nursing professor has went through nursing school in their own way. As far as clinicals, our cohort was about 135 students, probably a few that also repeated and had to redo their clinicals, so we're a little bit over. So it was split between a lot of different sites. My clinical site was MD Anderson in the medical center, so it was a drive. It was me having to get up at 3:30, 4:30 in the morning to make it there at 6:30. But everybody's experience is different. I had a wonderful clinical nurse instructor. A lot of students for the first couple of weeks had to follow a PCT, which is a patient care tech around just to see what they do. But our clinical instructor was like, you need to be with a nurse. Your job is to be with a nurse, and you will definitely get those skills of a PCT's job because nurses do those as well. And I was a PCT before I actually started nursing school, so I was so excited to be with a nurse and learn from a nurse's point of view, which I think helped all of us out a little bit better. And my nurse preceptors, I had 3 different ones, maybe 4 different ones during my rotation, which was 8 weeks, but they were all great. They actually took the time to show me. They answered any questions. And during the first semester, you're not allowed to do a lot. And about halfway through the semester is when we were able to actually start administering medication with our clinical instructor watching us. They had to check off a few things. So we had like a heart and lung assessment that our clinical instructor had to check off. And then she had to check off our medication administration, of course, and I ate it. And we still weren't allowed to just freely give medicine with our nurses during first semester. We always kind of had to have our clinical instructor there to guide us because we're working under their license. They don't want us just going around giving medications. And when we did give medications, we just had to call them, but we had to know what the medication was, what it did to the body, contraindications, and things like that, just because we want to be safe. We didn't take pharmacology yet, as that is a second semester class, so you'd still have to look up a few medications. We didn't know too much about medications, that's why we weren't the ones really giving a lot of medications, but we kind of got to see how things worked. Like, I definitely got to see out of prime, IV tubing, and got to see an IV push. I got to see an NG tube being placed in someone and how that works. You see a lot of things, and my thing is, like, first semester you're pretty much shadowing the whole semester, but go ahead and join. Like, if a nurse is doing something or you haven't seen something, do it. If you haven't performed that skill, check with your clinical instructor to see if it's okay for you to do that skill, and then be there for you to try, because we have to learn as much as we can. Like I said, nursing school is 16 months long and it goes by fast. And after that, you're expected to be a nurse, passing your NCLEX in the hospital. You're expected to do these things on your own. So why not try for the first time while you're in clinical? Like, if there's something that you can do, go ahead and do it. Like, and that's how you get close to your clinical instructor. They see you doing something, you try, and your preceptor's giving good feedback. That's only going to be good to you. It felt so good when I went to other classes and professors that I didn't know if they knew my name, because we're over 100 people in our classes, knew my name and was like, hey, this professor has such good things to say about you while you are doing clinicals, and I just want to say you're doing a good job. And just that feedback makes me feel reassured that, hey, I'm here in nursing school and this is where I should be, and I'm doing the right thing. Because, you know, sometimes you feel like a fish out of water sometimes. Like, hey, everybody's so smart. There's some people that make straight A's. There's some people that don't have to study and they make good grades. You know, I felt that I wasn't smart enough. Like, yeah, I got here, I got the grades to get here, but dang, some of these people are smart. But there's a reason why you were chosen for nursing school. There's a reason why I was chosen for nursing school and to get in. It's a very hard program to get in. They don't let anybody in. Get yourself a planner and stick to that planner. That's one mistake I didn't do. And when exam times came, I found myself struggling to study for exams because they came fast. You have one exam, you got another one 2 days later. There's no way that in 2 days you're going to learn all the material that you need for that second exam. So you have to kind of split up your week, split up your days, and study. I know it's very common that people say you have no life, you can't go here, you can't go there. You just have to time manage. And that's one thing that I'm learning how to do, and I'm trying to do better for my next semester, is to time manage. You really have to set a study schedule of, I'm studying these subjects this amount of time, and not taking too long to review things. Like, you go over something in lecture, like, go over it. At least take an hour, 2 hours to go over the material that you went over for the day so that it sticks in your mind. And then come back to it. You want to do a little bit every day. That's one thing that I did and helped me on a lot of my exams and studying, is that I went over a little bit every day, and I didn't just crunch. I did do one overnighter, and that didn't help. Literally, for one of my patho exams, I pulled an all-nighter and stayed up and studied all night because I ran out of time and didn't have time to fully go over a subject, and I didn't do as well as I wanted. I actually failed that exam. At UTMB, you have to make a 75 to pass. A 75 exam average, and then a 75 in the class. If you have below that, you will fail the course. There are people that fail the course, unfortunately, and I don't want that to be anybody. I would also keep an eye on your grades. I use a grade app on my phone, and I literally kept track of the percentages of what each exam is worth, and I had two tasks for each, my exam grade and my final grade, and I had to make sure both of those grades were over a 75. So as I was taking my exams, usually we get our exam results within 1 to 2 days. Some classes we got the exams back sooner. Some classes took a couple of days before we got them back. Only because the professors actually go over the exams. They do get, I guess, like a summary of how well each question did and what questions were okay and which questions were performed low on. And there is a notes section where we're able to write notes to the professor, just because sometimes some of the answer choices and the question themselves could be confusing. The professors write their own questions, so it doesn't come from a standard book. They write their own questions about the subjects that they teach, because each subject, each body system is taught by a different professor most of the time. It's usually 2 to 3 of them, but some classes I've had up to 5 different professors, such as pathophysiology, that they taught just because it was a little bit more familiar with them. They were nurses in that field, so they're able to give us the ins and outs. If we had questions, they were able to answer them, so they make their questions. And as far as going over things, go over the section that you're gonna cover before class, before you go into lecture. Just because if you have any questions, you're able to ask the professors right then and there. And no question is a stupid question. Trust, I've heard it all. We have jokesters in our class, we have serious people in our class, and I've heard crazy questions being asked. And you need to ask. If it's a question that you need to know, ask them so that you can get clarification on it. I'm sure you can find it somewhere else, but if the professors there, they are another resource. You can always email them at any time, and they usually reply within a couple of days with that answer. But what's the point of waiting? You have gone over the material a little bit, not saying read the whole chapter. At least go over the main objectives. For all the subjects we had PowerPoints that the professors provided with objectives, and at least go over those objectives before class, so you kind of get an idea of what they're talking about, and you can ask any questions that you need. And then after the class, you can go in further detail. You can kind of put all your notes together that you got from the lecture and the PowerPoint. You can go over things in your book and just collate your own notes in a way that will help you study. If that's doing Quizlets, if that is doing paper flashcards, if that's writing things down, I see it all. And it depends on your learning style and how you learn. You really have to figure out your learning style. I'm someone that is very much a kinesthetic learner and slightly visual. So going and taking all my notes and rewriting them again and seeing the information really helps me. Going and watching YouTube videos, registerednursern.com is a savior when it comes to nursing school, especially pathophysiology, because we do have quizzes in that class, and you never know what to expect on the quizzes. And you want to kind of do good on those, because those can help your grade or they can hurt your grade. They aren't worth that much in the class, but if you're on the edge, they can really hurt your grade. They can bring your total average below that 75 and you'll fail the class. So you have to study, you have to be prepared for class. And usually during my semester, our pathophysiology teacher did send us subjects for us for our quizzes, so we're able to know exactly, hey, study these diseases, study the processes, and you learn. I feel like halfway through you learn how to study for these classes. You learn how to answer the question. I want to find a group of friends that are serious about work and studying and nursing school, and you want to form a study group. I have a study group where about 6 people, sometimes everyone comes, sometimes it's only a few. Some people live off the island, so they meet on certain days to study themselves. But honestly, my group has helped me. Every time one of my group members, right before exam, we kind of meet up again before we're waiting to get into the exam room, and we kind of do spitfire questions where we're asking questions, and I guarantee you it's always 1 to 2 questions that's on every exam that my friends spit out to me that's on the exam, like literally exact. And just because of that, I got that answer right. So you need to make sure you get a study group. You need to make sure you get people that are serious about it. And I do know a lot of times when you're in study groups, it gets to the point where we're not studying, we're gossiping, we're talking about everything in the world, and it's okay, but as long as your main focus and time is focusing on studying and the subjects that you really need to know. And just having that encouragement that, hey, you can do this, you can pass, you know the material, it helps. it helps. Just having people that root you on. Honestly, I don't think I could have gotten through my first semester nursing if it wasn't for the group of girls that have stayed by my side and helped me since day one. And just if you need clarification, sometimes your friend might have worked in a hospital and know a specific body system a little better. They're able to answer those questions for you. They're able to help you understand it in different ways, especially if people have different ways of learning and learning styles. Just because you're not a kinesthetic learner doesn't mean you can't learn from me teaching you something or me bringing up a subject, and because you're a visual or auditory learner. You just learn, and you learn the people that's in your class, and your cohort pretty much gets very close. You talk to people, the people that you go to clinicals with, you confide in them and just see how they're doing, and it was sad because we did have people drop out, and we tried to be there for them as much as possible, but for whatever reason, I would say keep doing it. I'm a person that I'm not about to quit. If I fail an exam, if I fail a test, I'm still gonna try. I'm still gonna go on, and my friends were there, especially when I didn't do the best on the exam. They were there to say, hey, you didn't do that bad. You can pick it up on the next exam. We're gonna go over things that you weren't comfortable with, and we're gonna, try different ways. And that was like the biggest help, just having some people there, a study group that you trust, that are smart, that are about their business, and that you can study with, and then once the studying is over, you can go have a good time. You can go eat out to Chili's and have you some chips and salsa, because we definitely did pretty much after every exam. So I would never give up my girls for nothing. They are awesome. And you want to stay on top of things. You should have enough time, if you know how to time manage your schedule, to have family time, to have friends time, to have time where you're not always in a book. You don't want to get to the point where that's all you do, because it will be depressing. It will be hard. And yes, it's 16 months and the program goes by fast, but it's 16 months of you can be miserable or have the time of your life. Nursing school is a time for you to have fun, for you to learn, for you to try new things, and for you to really get a feel of the nursing field. So keep on trying. So as far as the end of the video goes, I will have kind of a few pictures and videos of me and my friends and kind of how nursing school went a little bit. So once again, thank you for watching. Please subscribe. Please like the video. Leave a comment if you have any questions. I will be there to ask them. So thank you.
Keep it 100.